What's going on, guys? My name is Steve. Thank you for stopping by my channel. I'm just an American guy on a journey to discover my British and Irish ancestry. Today, we're going to be reacting to the true cost of U.S. healthcare shocks the British public. I don't doubt that the average British citizen probably has no idea how much it truly costs for healthcare in the U.S. I think at this point, most people understand the U.S. doesn't have a universal healthcare system like you guys have in the U.K., but I would guess that the average person in Britain would be shocked, well, as the title says here, about the actual cost of health care procedures and whatnot. So anyways, guys, let's go ahead and check this out. What does the average British citizen think about the cost of U.S. healthcare?
10 grand for a baby.
Is there a price for
Oh,
that?
yeah.
Yes.
Jeez, $100, $200?
$2.5 grand.
$80.
600.
250.
More.
Shut the fridge.
More.
£300.
Double it.
$600. $600.
Yeah. Ambulance call out. How much do you think that costs?
Zero payment.
Zero payment.
Yeah, zero payment.
No. It costs $2,500.
For real?
Yeah.
Oh, okay, cool.
You look
Cool.
An inhaler.
$100.
Yeah, you're pretty close. It's a bit more.
120
250 to 350.
for an inhaler.
Yes.
Man, so if you're poor, you're dead.
I know that it's like public healthcare in the UK. In the US, fortunately, I'm able to get healthcare through my parents, their jobs, but like I carry an EpiPen, and I know that like the cost
Woo,
of that has just
those
been rising.
have gotten
Like, there's,
expensive, I know.
Very few companies that even compete, so it's sort of like a monopoly for the EpiPen.
Yep.
Even though like we have insurance, it cost my parents about a couple hundred, even with insurance.
So 2 EpiPens. How much do you reckon they are?
$80.
600.
$40.
I'm afraid not.
More?
More.
$100.
More.
150.
More.
250.
More.
Shut the fridge.
More.
Shut the fridge.
£300.
Double it.
$600. What?
Is that a phrase that is used a lot? Shut the fridge? Because I know in the U.S. we say something similar, but it's shut the front door. I'm just curious: is that the same type of phrase but used slightly different?
Why?
That's a very good question.
$600.
Yeah.
For me, it's more like just hives and shortness of breath. So it wouldn't be like an immediate death situation, but like, so I've been fortunate I've not had to use it, but it's something like keep on me. Like I have my backpack right now, I have it on me.
Cost of childbirth.
Jesus. 50 grand, something ridiculous now?
Yeah, see, I've blown the figures up on your head now, haven't I? Because they're larger. It's the highest, generally speaking, is about 30 grand.
Oh, okay.
Is that reasonable? You haven't.
Not reasonable at all. It's just like now we're on like we're on a bench.
Yeah.
100? 200?
Dollars.
Yeah.
The average is about 10 grand. It can go up to 30,000.
10 grand for a baby.
Yeah, well, I guess. How much is your child worth?
Yeah. What, is that like the same everywhere?
Yeah, the average is about $10,000. Yeah.
That's mad.
It does depend on how you want to have your baby. If you want to have your baby in a hospital, it's going to be much more expensive. If you decide to go the midwife route, and do it at home, it can be less expensive. Obviously, if you did that, you want to make sure that your midwife knows when that you may need a doctor. My wife and I looked into all that stuff. So yeah.
Oh, no thanks.
Okay, no thanks. In which case, the coil, IUD, contraception, how much do you think that costs?
For one person to implant a grand?
Yeah, a little bit higher.
Really?
Yeah, $1,300.
Oh. Mental.
I wonder if you could tell me how expensive you think calling an ambulance out to your location is in America.
I guess it depends on like where you live. It really does. Is there a price for that?
Yes.
Jeez. $100, $200?
$2.5 grand.
For what? Why? Why?
Give birth by C-section,
Yeah.
and you would like to hold your baby after you've given birth to it.
Naturally, yeah, that's what you do. Yeah. You have to pay to do that.
Yes.
To hold my own child that I've been carrying inside of my womb.
Say something else.
Sorry, I was.
But yes.
Jeez.
It's not actually that expensive.
Right. Charging me, I'm gonna punch you.
Yeah.
No
Not
doubt.
you, but the doctor. Like $100.
$40
$40.
for skin-on-skin contact. What do you think of the NHS?
Literally the gift that keeps on giving. Literally, people are so dumb for taking advantage of it, and I don't want it to change.
Finally, does it make you grateful for the NHS?
Absolutely, absolutely. I mean, I didn't know how much free healthcare we got, like, just off the bat, but, like, knowing you have to pay, like, 30 grand for a child, it's outrageous. It really is ridiculous. So thank you, NHS, for your hard work.
I'm genuinely speechless.
Presumably you had an idea that healthcare was expensive in the US.
I didn't realise how expensive. Yeah, I'm just like, what? Like, if you don't have money, you're
Well, yeah, potentially.
fudged. Yeah.
What do you think of the people who are profiting off the sale of these medicines?
You're bastards. Sorry, beep. I think, yeah, I think they should be stopped.
All right. Well, that was interesting. It's about what I thought, that people, generally speaking, wouldn't quite understand how much the cost of healthcare is here. Now, granted, a few things, one thing that really upsets me here in the U.S., you got certain things that aren't just, they're needed. You take type 1 diabetics, man, and they need insulin, and they need to pay for that. And it's just to me, that's disgusting. I mean, out of everything, you would think that America would be able to find a way to make sure diabetics can get their insulin for free. We're in 2022. But a couple of things to point out is that, if you're very low income or if you're poor in America, you don't have to worry about healthcare. Generally speaking, if you're very poor, very low income, you can get on Medicaid, and that covers everything. Not to say someone, it's good someone's poor or whatever. That's not what I'm saying. I'm saying, though, like, when it comes to healthcare costs in America, poor people are not the ones that have to worry about it. They get basically the equivalent of universal healthcare for the most part. They may have to shell out, $3 or $4 when they go to a doctor or something. But generally speaking, very poor people are, they get health care. Wealthy people can easily afford their, health care here. The issue are middle class people. They're the ones that don't get any assistance from the government, but then they have to pay these really high prices for health insurance. And just as an example, I'll even go back to before I had a child. Health insurance gone up since then. But just when it was just my wife and I, we didn't want to pay the extremely high price for like extremely good health insurance. So we got a health insurance that was, I think it was $12,000. Was it $12,000 or $15,000 deductible? Meaning that basically, if you went to the hospital or something like that, you had to pay $12,000 or $15,000 out of pocket before anything was really covered. So for small things, it's basically useless. But anyway, for that not the worst health insurance, but not the best either, that was almost $700 a month just for 2 adults. $700 a month. And that was back before we had our daughter. I mean, last time I had health insurance before I had my daughter was 2017, 2016. So we're talking 5 years, 6 years. And it was almost $700 a month then for not even that great of insurance. If you're talking about two adults, if you were to have 2 adults and you want the best health insurance, you're paying over $1,000 a month easily. Add a child in, it's even more. If you pay $1,200 a month or something for that health insurance, then you know what? Stuff is pretty okay then. But you're already paying, well over $10,000 a year for that health insurance. That's why I say it hurts the middle class the most. Let's imagine that you're making $40,000 or $50,000 a year, and to actually be covered with some decent health insurance, you're paying $10,000 a year, let's say. You know, you're paying 20% of your income just to the health insurance that then in return you still have to pay a deductible on top of it. It's a mess, you know. It's you know, I don't know what the answer is, because in America there's no way we're ever going to come to a middle ground of some sort between both sides, you know what I mean? Both extremes. There's people on both sides pulling, saying we won't give an inch so we can actually make some sort of progress in the right direction. It's like people on one side, they're like, we need universal health care for everything, no matter what the circumstances, and we're not going to budge, knowing that there's no way the other side's going to give in. Then the other side's like, you need to pull yourself up by your bootstraps, and we should have no universal assistance at all. There's got to be a middle ground that we can come to that can make it to where healthcare in this country is more affordable at the very least. And for some reason, it's just a fight that no one is willing to kind of budge on their side to actually meet in the middle, meet at the table and say, okay, we both don't agree with each other, right? But there's got to be some things we can agree on to make this country a better place. And this is sad. It's a shame that people, they join their little tribes and their partisan sides so much that they're not willing to budge. And that goes for both sides. You know, I'm sitting here in the middle like, hey, I'd meet you in the middle and talk to both of you people and come to a solution. But no, not people aren't willing to do that. We've gotten so partisan in America, and I think to some extent all around the world, that, you know, we won't even talk to the other side. People literally hate people that are on the other side of their political spectrum. And that's why we can't get anything done. Because even though you might be right, understand people have gotten to their thought process about things from their life experiences. And you're not going to budge them by hating them or being angry because they believe what they believe, or calling them stupid or names or whatever. No, the answer is to say, you know what? I disagree with you, and I know you disagree with me, but there's got to be a way we can come together and both win. We can come together and get a little bit of what we both want so that everybody's happier. And I think there was a time, actually, I know there was a time, go back to when I was a kid, go back when I was a teenager. You know, it wasn't so partisan. People would discuss politics, they would disagree, and then they would shake hands, be like, I love you anyway. I don't like what you believe there, but you know what? I love you. Let's go have a beer, or, you know, let's go eat some dinner or whatever. You know, politicians would do the same thing. They would kind of meet in the middle. They would be like, you know what? I disagree with you, but we got to come to some sort of solution. Now you can't do that anymore. And I don't know what's to blame exactly for that. I think there's a lot to blame for that. You know, I think social media in some ways has heightened that partisanship. I think the media has heightened that partisanship because it sells. You know, the media want to divide us, you know, because it sells when we're angry at each other. And when we're angry at each other and fighting with each other, not only do we not get nothing done, we let the people that are actually the enemies of everybody, they win, because we're too busy paying attention to fighting amongst each other. Granted, not me. I don't fight with anybody about their politics. I'll let you be what you want to be. And I try to get along with everybody. I don't want to be a divisive person. I want to be a unifying person. That's what I want this channel to be. You know, I don't care if people talk about politics and their beliefs on this channel, but what I don't want this channel going to is a tribalist political channel. That's not what I want to do. I want to be able to talk about political stuff without being tribal, without being partisan. I want everybody to be heard. I want everybody to feel welcome. I want us to be able to look at each other and be like, you know what? I don't agree with you, but you know what? You didn't get to that place where you believe that because you're a bad person. You got to that place because it's what your life experience is. Your parents, the schools you went to, the communities you were raised in, your whatever, like the people that you started following on social media, all that type of stuff ends up making a person believe the things they believe, whether it's what you believe or not. And too often we allow that to divide us. And I don't know why I got off on this tangent. I just wish that people could come together so we could have real solutions to problems. In America, obviously in Britain too, but in this case, America's the one that's got the extremely expensive health care. And, you know, it hurts a lot of middle-class people especially. And when I say middle class, I don't always just mean like the high middle class. We're talking about, it actually hurts the low middle class even more, you know, because they can't get that much assistance, but they got to pay for that full-on health care. But anyways, guys, enough of my rambling. I just wish there was a solution. Anyways, guys, thank you so much for watching. Please click that like button. Feel free to share your comments and suggestions. And don't forget to subscribe to continue to follow me on my journey to discover my British and Irish ancestry. Until next time, guys, peace.